Welcome to Pinoy Medical Coder. Today, we'll discuss about COVID-19 coding and billing updates, April 1st update. Before we begin, please don't forget to like our Facebook page and like and subscribe to our YouTube channel. What is COVID-19? COVID-19 is a virus that primarily causes respiratory signs and symptoms. Many with the virus show no symptoms or symptoms similar to a common cold. Those who are immune compromised, however, can experience a wide range of conditions such as pneumonia and acute respiratory distress syndrome. COVID-19 updates. April 1, 2020. U07.1 can now be used. New guidelines were published and are included below. March 31, 2020. G2023/G2024 update. To identify specimen collection for COVID-19 testing, we are establishing two new Level 2 HCPCS codes. Independent laboratories must use one of these HCPCS codes when billing Medicare for the nominal specimen collection fee for COVID-19 testing for the duration of the PHE for the COVID-19 pandemic. March 26, 2020. Senate passes the Coronavirus Aid, Relief and Economic Security, CARES, Act, which will allow for a 20% increased payment on COVID cases. March 26, 2020. CMS announced the release of an updated ICD-10 MSDRG group or software package to accommodate the new diagnosis code, U07.1 for COVID-19, effective with discharges on and after April 1, 2020. If you use an encoder, please check with them to determine if the update will be ready for your organization prior to April 1. March 23, 2020. CMS guidance on COVID-19 DRGs post-April 1. See below for details. March 19, 2020. Earlier today at the White House Task Force press briefing, the Centers for Medicare and Medicaid Services, CMS, announced that all elective surgeries, non-essential medical, surgical, and dental procedures be delayed during the 2019 novel coronavirus, COVID-19, outbreak. March 18, 2020. New code effective April 1 U07.1. More coding guidelines to come, but for now. Use additional code to identify pneumonia. Excludes B34.2, B97.2, J12.81. March 16, 2020. The AMA just released a new code, effective March 13, 2020, CPT code 87635. March 13, 2020. IRF waivers at www.racmonitor.com. COVID-19 coding for laboratory testing. CPT/HCPCS code and CPT description. U0001, 2019 novel coronavirus real-time, RT-PCR diagnostic test panel at a CDC lab. U0002, 2019 nCoV coronavirus, SARS-CoV-2, 2019 nCoV, COVID-19, using any technique, multiple types or subtypes, includes all targets, at a non-CDC lab. 87635, infectious agent detection by nucleic acid, DNA, or RNA, severe acute respiratory syndrome coronavirus 2, SARS-CoV-2, coronavirus disease, COVID-19, amplified probe technique, COVID-19 and related diagnosis codes. These are common diagnosis codes seen with COVID-19, but is not all-inclusive. Remember that per coding guidelines, the provider's diagnostic statement that the patient has the condition would suffice. Some organizations, however, may choose to hold accounts until lab results are confirmed, according to CDC guidance. Column 1, Diagnosis Code. Column 2, Diagnosis Description. Column 3, Rules. U07.1, COVID-19, effective on April 1st, should be sequenced first in most scenarios. Newborn cases could be an exception. Obstetric cases could be an exception. Reason for admission could change this. Only to be used for confirmed cases, per CDC. Can be used for physician documentation of a presumptive positive test, per AHA. Cannot be used for probable, suspected, etc. B97.29, other coronavirus as the cause of diseases classified elsewhere. To be used for COVID-19 prior to April 1st, but is not specific to COVID-19. Not to be used in addition to U07.1. Z03.818, encounter for observation for suspected exposure to other biological agents ruled out. A code from category Z03 is assigned when a person is suspected of having a condition, without signs or symptoms, and after examination and observation, the condition is ruled out. If a definitive diagnosis exists, then it should be coded instead. If other, non-related, signs and symptoms exist, then those should be coded. Z20.828, contact with and suspected exposure to other viral communicable diseases, for someone with no signs and symptoms but they have been exposed to someone with COVID-19. COVID-19 coding scenarios. Reporting contact only. Z20.828, contact with and, suspected, exposure to other viral communicable diseases, should be reported if the patient has had contact with someone who has tested positive but the patient has no signs and symptoms. Reporting observation only. Z03.818, encounter for observation for suspected exposure to other biological agents ruled out, should be used if the patient is being observed for what is thought to be COVID-19 but the test was negative or it was ruled out. In this case it is important to also code the signs and symptoms that the patient is experiencing. COVID-19 coding scenarios. Guidelines. According to the instructional note under category Z03, a code from category Z03 is assigned when a person is suspected of having a condition, without signs or symptoms, and after examination and observation, the condition is ruled out. Prior to April 1, 2020, code B97.29 is assigned for all types of documented coronavirus as cause of diseases classified elsewhere except severe acute respiratory syndrome, SARS-associated coronavirus, which is classified to code B97.21. Common types of coronavirus include alpha coronavirus, beta coronavirus and Middle East respiratory syndrome, MERS. Note, if another definitive diagnosis is reported instead, then that would take the place of Z03.818. Reporting a confirmed case before April 1st. With pneumonia. If the pneumonia is confirmed as being due to a confirmed case of COVID-19, code J12.89, other viral pneumonia. B97.29, other coronavirus as the cause of diseases classified elsewhere. With acute bronchitis. If the bronchitis is confirmed as being due to a confirmed case of COVID-19, code J20.8, acute bronchitis due to other specified organisms. B97.29, other coronavirus as the cause of diseases classified elsewhere. With lower respiratory infection. If the lower respiratory infection is confirmed as being due to a confirmed case of COVID-19, code J22, unspecified acute lower respiratory infection, not otherwise specified. B97.29, other coronavirus as the cause of diseases classified elsewhere. Alternatively, if they state that it is another type of respiratory infection, not included in other coding options, then you would use J98.8, other specified respiratory disorders, with B97.29. With ARDS, acute respiratory distress syndrome. Patients with COVID-19 may develop ARDS. If this occurs, code as such. JAD, acute respiratory distress syndrome. B97.29, other coronavirus as the cause of diseases classified elsewhere. Reporting a confirmed case after April 1. With pneumonia. If the pneumonia is confirmed as being due to a confirmed case of COVID-19, code U07.1, COVID-19. J12.89, other viral pneumonia. With acute bronchitis. If the bronchitis is confirmed as being due to a confirmed case of COVID-19, code U07.1, COVID-19. J20.8, acute bronchitis due to other specified organisms. With lower respiratory infection. If the lower respiratory infection is confirmed as being due to a confirmed case of COVID-19, code U07.1, COVID-19. J22, unspecified acute lower respiratory infection, not otherwise specified. Alternatively, if they state that it is another type of respiratory infection, not included in other coding options, then you would use J98.8, other specified respiratory disorders, with B97.29. With ARDS, acute respiratory distress syndrome. Patients with COVID-19 may develop ARDS. If this occurs, code as such. U07.1, COVID-19. JAD, acute respiratory distress syndrome. COVID official guidelines, effective April 1, 2020. Chapter 1, Certain Infectious and Parasitic Diseases, A00 to B99. G. Coronavirus infections. 1. COVID-19 infections, infections due to SARS-CoV-2. A. Code only confirmed cases. Code only a confirmed diagnosis of the 2019 novel coronavirus disease, COVID-19, as documented by the provider, documentation of a positive COVID-19 test result, or a presumptive positive COVID-19 test result. For a confirmed diagnosis, assign code U07.1, COVID-19. This is an exception to the Hospital Inpatient Guidelines Section 2, H. In this context, confirmation does not require documentation of the type of test performed. The provider's documentation that the individual has COVID-19 is sufficient. Presumptive positive COVID-19 test results should be coded as confirmed. A presumptive positive test result means an individual has tested positive for the virus at a local or state level, but it has not yet been confirmed by the Centers for Disease Control and Prevention, CDC. CDC confirmation of local and state tests for COVID-19 is no longer required. If the provider documents suspected, possible, probable, or inconclusive COVID-19, do not assign code U07.1. Assign a codes explaining the reason for encounter, such as fever, or Z20.828, contact with and, suspected, exposure to other viral communicable diseases. B. Sequencing of codes. When COVID-19 meets the definition of principal diagnosis, code U07.1, COVID-19, should be sequenced first, followed by the appropriate codes for associated manifestations, except in the case of obstetrics patients as indicated in Section 1, C, 15, S for COVID-19 in pregnancy, childbirth, and the puerperium. For a COVID-19 infection that progresses to sepsis, see Section 1, C, 1, D, sepsis, severe sepsis, and septic shock, see Section 1, C, 15, S, For COVID-19 in pregnancy, childbirth, and the puerperium. C. Acute respiratory illness due to COVID-19. I. Pneumonia for a pneumonia case confirmed as due to the 2019 novel coronavirus, COVID-19, assign codes U07.1, COVID-19, and J12.89, other viral pneumonia. 2. Acute bronchitis for a patient with acute bronchitis confirmed as due to COVID-19, assign codes U07.1, and J20.8. Acute bronchitis due to other specified organisms. Bronchitis not otherwise specified, NOS, due to COVID-19 should be coded using code U07.1 and J40, bronchitis, not specified as acute or chronic. 3. Lower respiratory infection if the COVID-19 is documented as being associated with a lower respiratory infection, not otherwise specified, NOS, or an acute respiratory infection, NOS, codes U07.1 and J22, unspecified acute lower respiratory infection, should be assigned. If the COVID-19 is documented as being associated with a respiratory infection, NOS, codes U07.1 and J98.8, other specified respiratory disorders, should be assigned. 4. Acute respiratory distress syndrome for acute respiratory distress syndrome, ARDS, due to COVID-19, assign codes U07.1, and J80, acute respiratory distress syndrome. D. Exposure to COVID-19. For cases where there is a concern about a possible exposure to COVID-19, but this is ruled out after evaluation, assign code Z03.818, encounter for observation for suspected exposure to other biological agents ruled out. For cases where there is an actual exposure to someone who is confirmed or suspected, not ruled out, to have COVID-19, and the exposed individual either tests negative or the test results are unknown, assign code Z20.828, contact with and suspected exposure to other viral communicable diseases. If the exposed individual tests positive for the COVID-19 virus, see Guideline A. E. Screening for COVID-19. For asymptomatic individuals who are being screened for COVID-19 and have no known exposure to the virus, and the test results are either unknown or negative, assign code Z11.59, encounter for screening for other viral diseases. For individuals who are being screened due to a possible or actual exposure to COVID-19, see Guideline D. If an asymptomatic individual is screened for COVID-19 and tests positive, see Guideline G. F. Signs and symptoms without definitive diagnosis of COVID-19. For patients presenting with any signs and symptoms associated with COVID-19, such as fever, etc., but a definitive diagnosis has not been established, assign the appropriate codes for each of the presenting signs and symptoms such as R05, cough, R06.02, shortness of breath, R50.9 fever, unspecified. If a patient with signs and symptoms associated with COVID-19 also has an actual or suspected contact with or exposure to someone who has COVID-19, assign Z20.828, contact with and suspected exposure to other viral communicable diseases, as an additional code. This is an exception to Guideline 1, C, 21, C, 1, contact or exposure. G. Asymptomatic individuals who test positive for COVID-19. For asymptomatic individuals who test positive for COVID-19, assign code U07.1, COVID-19. Although the individual is asymptomatic, the individual has tested positive and is considered to have the COVID-19 infection. Chapter 15, Pregnancy, Childbirth, and the Puerperium, 000 to 09A. S. COVID-19 infection in pregnancy, childbirth, and the puerperium. During pregnancy, childbirth or the puerperium, a patient admitted, or presenting for a healthcare encounter, because of COVID-19 should receive a principal diagnosis code of 098.5, other viral diseases complicating pregnancy, childbirth and the puerperium, followed by code U07.1, COVID-19, and the appropriate codes for associated manifestations. Codes from Chapter 15 always take sequencing priority. Common DRGs before April 1st. Please note that COVID-19 will not link to a specific DRG as the scenario will vary by patient. That being said, the most common DRGs that we will see are as follows. Common DRGs after April 1st. DRG add-on. During the emergency period, the legislation provides a 20% add-on to the DRG rate for patients with COVID-19. This add-on will apply to patients treated at Rural and Urban Inpatient Prospective Payment System, IPPS, hospitals. The ICD-10-MC version 37.1. R1 uses edits for the ICD-10 codes reported to validate correct coding on claims for discharges on or after April 1, 2020. The ICD-10 MSDRG grouper software package to accommodate this new code, version 37.1 R1, is effective for discharges on or after April 1, 2020. Assignment of new ICD-10 CM diagnosis code U07.1, COVID-19, is as follows. Please see table here. Query templates, COVID-19. Patient admitted with symptoms such as fever, dry cough, SOB, and noted to have lab test positive for COVID-19. Please document and progress notes and discharge summary if you are evaluating or treating any of the following. Pneumonia due to COVID-19. Acute bronchitis due to COVID-19. Acute lower respiratory infection due to COVID-19. Other, please specify. Unable to determine. The medical record reflects the following. Risk factors. Clinical indicators. Treatment. Below not to appear in query itself. Possible risk factors, age, any chronic medical conditions, and acute conditions that would complicate anything. Any recent sickness, flu or pneumonia, etc., exposure to someone with COVID-19. Clinical or diagnostic criteria, symptoms, labs, COVID-19 test result, positive or negative. Treatment, meds, monitoring, if they mention what PPE the hospital staff use or droplet isolation. Query templates, POA. Patient admitted fault with pneumonia, acute bronchitis, LRTI or respiratory symptoms. Patient noted to have laboratory test positive for COVID-19. If possible, please document and progress notes and discharge summary if was present on admission, POA. Yes, COVID-19 was present at the time of the order to admit to the hospital. No, COVID-19 was not present on admission and developed during the inpatient stay. Clinically, you are unable to determine if COVID-19 was present on admission. The medical record reflects the following. Risk factors. Clinical indicators. Treatment. For more info, please check the following website at ensemblehp.com. This video was brought to you by Pinoy Medical Coder. Thank you for watching.